Okay, good afternoon, folks. Welcome to the Joint Conference Committee meeting for Laguna Honda Hospital for March 9th, 2026. Mr. Morwitz, we call the roll.
Yes, I'll start with you, Vice President Guillermo.
Present.
President Green.
Present.
And we also have Commissioner Gerardo, who will just be in the room for the housing item. And so I'm going to note you in the minutes, Commissioner, for that. And I'm also noting the change that I emailed the public about, and also it's on the website. We're changing the order of the agenda today. Item 6, senior affordable housing at Laguna Honda campus, will be moved up to item 4 before the executive report. All right, I will now read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to item 2, the approval of the February 9th, 2026 meeting.
Okay, we have the minutes before us, and I would like to ask for a motion to approve,
Move to approve.
and I'll second that.
And let me text the public. There is any public comment in the room on the minutes? Item 2. No public comment.
Okay, great. All those in favor?
Aye.
Okay,
Wonderful. Item 3 is general public comment. This is an item for folks to comment on issues that are not going to be discussed on the agenda or listed on the agenda. Is there any general public comment in the room? I see no hands. I see no hands in the public. So we can move on to item 6, the senior affordable housing at Laguna Honda campus. And I will pull up the.
first I'd like to thank Commissioner Gerardo for joining us for this particular item.
Good afternoon, Commissioners. My name is Ann Romero. I'm a Senior Project Manager at the Mayor's Offices of Housing and Community Development. And today, as you know, we like to present on the proposed childcare to address the many comments and questions that have been raised by commissioners and staff. Today, we've invited experts in childcare at the city, which are also known as the ECECs, or Early Childhood Education Centers, who are very familiar with this proposal. So today we have Graham Dobson, Senior Policy Analyst at the SF Department of Early Childhood, who will be joining me here. And we also have Liz Winograd, the ECE Deputy Director of the Low Income Investment Fund, attending in case you have questions for her. So now I will go to our agenda. So today we'd like to review the San Francisco policy to co-locate childcare at affordable housing sites, because this is obviously not the first one, and we have many, and this is the childcare policy here that are publicly funded in the city of San Francisco. We want to address questions on financial and operational stability. We will review Mercy's experience in developing childcare at their affordable housing sites. Then Sharon Kristen from Mercy Housing will be giving a general overview of the relative size of the proposed ECEC compared to the senior living spaces. And she will also provide an update on the child care request for proposals. And then finally, we'd like to review the upcoming meeting schedule for the JCC and the Health Commission. And so first, stepping back a little bit, I just wanted to review that, as you know, the design has evolved so that there are essentially 2 separate wings on the ground floor. So one is with the senior resident healthcare and senior center spaces, and the other one is for the child care. So the senior serving spaces on the interior are about 10,300 square feet, including the senior center. And there's the ability for the community room and the senior center to join together for a larger space. And including the outdoor population-specific spaces, the total is around 17,600. The childcare is around 6,600 square feet interior space, and including the outdoor spaces is around 9,750. So I just wanted to step back that is how the design has evolved. And so if we adjust the childcare space, it is not immediately proximate to where the senior living spaces are right now. But Sharon Kristen will be reviewing those spaces in a future item here that we're covering. So right now I'd like to invite Graham Dobson to speak about the need for childcare and in the specific neighborhood, and to explain San Francisco's Department of Early Childhood's model for building ECECs in San Francisco. Thank you.
Good afternoon, Commissioners. I'm Graham Dobson. I'm with the Department of Early Childhood. I'm just here to talk a little bit about some of the things that we provide on behalf of the city to support early care and education for 0 to 5-year-olds, and here in particular for infants and toddlers, 0 to 3. When we say infants and toddlers and we say 3 years old, we actually mean that those 3-year-olds are turning 4. So if you look at that age span within this project, we're actually looking at 0 up until 4 years old when those children would be going to preschool or transitional kindergarten. Just FYI. I understand that the childcare was always part of the original vision for this project. I know that Supervisor Norman Yee championed childcare in this development way back when he saw a neighborhood need after the loss of a child care center at 250 Laguna Honda. That was several years ago, way back when, before even the inception of this project. DEC, the Department of Early Childhood, I'll be calling it DEC just for shorter, to shorten it. We have a priority. One of our priorities is to co-locate childcare services in affordable residential property developments. And we've done that throughout the city. We've done it in both city-funded projects that are solely like Mayor's Office of Housing and Community Development. We've also done that within private public partnerships. And when I say that we support that, we are a grant-making agency, and so we provide funding for the build-out, the construction, the tenant improvement for childcare facilities. We do that through our contract with the Low-Income Investment Fund, who administer that funding. And then we also do it by supporting the program itself if they become part of what's known as our Early Learning for All network, which means that they have access to all sorts of resources from the city as a member of that. It means quality support. It means compensation enhancement for the teachers to make sure that they're making at least a minimum of $28 an hour and above. We support not just quality, we do education pathways so that the teachers have free access to higher education if they want to get a degree or get more units. So it's not just, and then also those programs can enroll families who are accessing our city subsidies and our tuition credit. So that's just a bit of an overview of what DEC does, and this program would be part of that network, and we would have access to all of those additional supports from the city as a member of our Early Learning for All network. And we have as an attachment, I think, to this presentation, there's an appendix that outlines a San Francisco childcare co-location policy that was developed by the Mayor's Office of Housing and Community Development, Department of Early Childhood, and with Low-Income Investment Fund. We came together with a process and some requirements and so just a pathway of how this should happen to make sure that we're all on the same page, and we have very specific requirements and expectations around this kind of idea of co-locating. I know here it's a little different because of the intergenerational aspect of this program, and I think we had some questions around what are the benefits of that, especially with seniors. But I know that some of the intergenerational programming benefits, including seniors and young children, are reduced isolation and improved mental health, There can be cognitive and physical stimulation on both sides, and also an emotional connection. And as a former teacher and a former director of childcare in the Tenderloin, we had seniors that worked in both our infant room and our toddler room who would spend time with those children. They would help at nap time. They would sit in rocking chairs and hold children if they were having a hard time. They would interact with the toddlers and play with them and do puzzles with them. They'd read stories. They'd just that connection is just, they were just part of the adult interactions in the space. And I think the intergenerational benefits of that are really extraordinary. As far as the need for childcare in San Francisco, I mentioned that we look at infants and toddlers up to 4 years of age, even though we call it 0 to 3. But the unmet need for childcare for that age group is about 83%. So the number of infants and toddlers that are in San Francisco and the number of licensed childcare spaces for that age group, there's an 83% unmet need for that age group. Now, we know that, especially with young infants, not all families are looking for a center-based program for their children at that age, but I know that working families with 2 working parents, and maybe they don't have the family support, would be looking for that. And so we know that that 83% may be inflated, but we know that the greatest unmet need is infants and toddlers. And so DEC, as part of our facility portfolio, has really been prioritizing expanding infant toddler capacity. We've been doing very, very well in San Francisco around pre-K capacity, where I think countrywide, we're probably one of the cities that has the greatest pre-K capacity based on the number of pre-K age children that we have in the city. And so I think we're way up in the high 90% of meeting the need for pre-K age children, especially now that transitional kindergarten is being offered by SFUSD. So it means that 4-year-olds, when children reach 4, they're able to access a TK, what's called a TK program in the school district. And it means that if that child starts at that TK program, they're able to then move forward within that school of choice. And so as a parent survey that we just did with DEC several months ago, we saw a very strong parental preference for TK for when children turn 4, because it gets those children into the school district at an early age. It's part of our universal pre-K program, but we're doing very, very well with pre-K capacity. And that's why any project that we fund now from DEC has to include infants and toddlers. And we would never consider a pre-K only program, especially as it might be in competition with other pre-K programs in the neighborhood who are struggling to get enrollment in those programs of children at that age. One of the things that we've done at DEC with our subsidies and our tuition credit is that we recently expanded the income eligibility for families to access either free childcare or a 50% tuition credit. And recently that went up to 200% of the area median income. That means that families who are a family of 4 earning £312,000 a year could access tuition credit. And so it's a huge step in the right direction. It means it expands the net of families who can benefit from city support. And I know it's part of Mayor Lurie's sort of, family friendliness agenda for the city. That's just recent, and it's going to come into effect in July of this year. So it's a big step forward to expand the net of families and hopefully employees at Laguna Honda that would be eligible for some kind of either free childcare or tuition credit, depending on their income. And tuition credit for an infant, I mean, it's as a 50%, tuition credit, that could be up to $16,000 saving a year, because infant full rate market rate childcare is very expensive. So it's a big saving for families if you're within that income range. So we see this project as sort of meeting the unmet need and having multiple community benefits, benefit for the workforce, benefit for the seniors and the children. It meets DEC strategic growth priorities, infants and toddlers focus. And now we're also looking at inclusive environments, and really any new program that we're developing, we really want to make sure that it supports children with different needs, and that we bring inclusivity into whatever design we have for any program moving forward. So the next slide. So, it talks about the need, what's an economy of scale or return on investment. And obviously these programs are a business and they need to make it work. We say anything, 45 and above generally works for programs. We see programs in the range of 45 to about 70 as being the optimum for a childcare program. And the size of the space, we have above licensing requirements to ensure a quality environment. So the city says that we have to have at least 50 square feet of usable child space within a classroom, and then 50 square feet of non-usable child space within that classroom. So we're looking at 100 square feet per child, which is way above the licensing requirement is 35 square feet per child. And so which we don't believe is a quality environment for children to be in. And so we have higher requirements as far as the number of children, the more space that children have within the classroom. Apart from the funding from the Department of Early Childhood that these programs that are part of our network have access to, the subsidies and the tuition credit. Many programs that we work with also get funding from the state, from the Department of Education and from the Department of Social Services. And some of our programs also get money from Head Start. So there's a wide range of eligibility for children from low-income children up to like higher income families. So a wide range of sort of mixed income families would be able to access these programs and access subsidies that would be available to them. So I know that 12 childcare centers have been created within affordable housing projects in San Francisco since 2020, and it created 600 new childcare spaces in the city, which is pretty great. I think we are doing, really well in this area, as opposed to other places in the state and in the country. Mercy Housing has significant experience in this model, which we'll see in a future slide. And we believe that the childcare will bring a tremendous benefit to both Laguna Honda and to DPH, where the staff will have a preference for enrolling. They'll have a priority for enrolling children there. And that this could hopefully strengthen both recruitment and retention of staff to have that benefit so close on site. And the next slide just shows the programs that Mercy Housing has been supporting, has been involved with up to now. 5 of these in the top layer are in San Francisco that are in operation right now, and they're all early learning for all sites that DEC supports. And there's another one in development, Kaiming at Trans Bay, again part of our network. Mercy always works with nonprofit childcare providers and has been a great partner so far. I'll be happy to answer any questions at the end of the presentation. So those are my slides. Thank you. Oh, one last thing I did want to say. Sorry, I forgot. I got a little post-it here. I forgot that. 94127 for the zip code. There's currently 20 licensed childcare programs in that zip code. 15 of them are family childcare homes, and 5 of them are centers. Of those 20, only 4 of them are early learning for all programs and benefiting from all the supports that we provide from Department of Early Childhood. And of the centers, you can have an infant license or a preschool license. None of the 5 centers have an infant license. They're all preschool programs. So I just wanted to give you that information too. Thanks for your time.
Thank you.
Thank you, Graham. That was very interesting. Hi, Commissioners. My name is Sharon Kristen with Mercy Housing. And on the next slide, we hope to provide a breakdown showing the areas of senior serving space within the site plan and early childhood education spaces. So in total, there's about 10,300 square feet of space that is senior serving. That's the northern wing, if you will, all of the yellow, the orange, the goldenrod. And the senior center, what we have shown is that the senior center there's a retractable door. So the senior center could share space with part of the senior community room for a space that could be up to about 2,800 square feet and serve about 80 seniors lunch each day. And again, the childcare space is to the southern wing, if you will, about 6,000 square foot internally, and with the outdoor space about 9,000 square feet. So next slide. Mark, thanks. And then this is a breakdown of the interior of the Early Childhood Education Center. This is just a draft of how the space could be laid out based on Dorman Associates working with LIF. And you can see the spaces and how the space is allocated between classrooms and support space. There's about 3,400 square feet that is classrooms, about 1,400 square feet that is admin space, and about 1,700 square foot that is basically circulation and support space. And that's all the interior spaces, not including the exterior space. And yeah, for an update on our RFP process, we have received now 6 proposals from interested childcare providers. So far, in doing a very cursory review of the proposals, there is strong interest and experience for doing an intergenerational program. Again, we would really rely on the early childhood education provider to lead that intergenerational programming, and the seniors, either coming from the senior affordable housing or the senior center, would be coming into the early childhood education center to be participating in that intergenerational program. We have developed our selection panel, which includes DEC staff, Graham, DPH rep, Mark Primo is working with us on that, LIF and Dorman Associates, as well as Mercy. And we hope to select a provider by April 13th. The full process will include interviews and will culminate in us entering into a letter of intent with them to continue working on developing the center. Next slide, please.
Sharon, could you clarify the age range of what the child care center is going to serve?
0 infants to 3. And as Graham said, those 3-year-olds actually could age into being 4 at the time that they're there.
Okay, thank you.
So essentially 0 to 4-ish. And then the next slide, this is our proposed schedule for some future meetings. At the next JCC meeting, we'd like to present the draft MOU with updates that reflect Laguna Honda staff's review of the MOU, and then to discuss, your request, your endorsement for the MOU, which would allow us to go before the full Health Commission, possibly in May, depending on the outcome of the next meeting. And I think as an appendix to materials, we did provide the city's childcare policy, this co-location policy, which is very specific as to how the housing provider will work with MOHCD, LIF, and their consultant architects and MOH to plan for the child care center. We could take any questions now that commissioners know.
So we don't take new questions. We do through public comment, and then the questions are with the commissioners.
Okay, we have a couple of public comments. I'll just name the 3 and you can come up when you're ready to speak.
And everyone has 3 minutes. I apologize, Vice President. Everyone has 3 minutes, and at the 32nd mark, there'll be a light ding, and then at the end of it, there'll be a louder ding.
Okay, Walter Kaplan, Manson, sorry, I couldn't read the last name, starts with an L, and John Tang.
Good afternoon, Commissioners. I'm Walter Kaplan from the Forest Knolls, excuse me, neighborhood organization. Forest Knolls is over 400 homes directly adjacent to Laguna Honda, along with the 800 homes in Midtown Terrace. We make up the neighborhood. I know Laguna Honda because in the 80s, I used to walk through the wards handing out cut flowers. I watched the new hospital be built. I've lived in my home for over 45 years. I was part of the selection committee that went through the RFPs and chose Mercy Housing to develop this project. As part of the original plan through today is the development of childcare on site as a part of the project. All of the documentation and the experts you have here can better than I tell you that they know what they're doing. They provide in the past, they've got a great track record. They're committed to making this project work. I'm sad that you couldn't build the third tower and accommodate another 400 people. I was also sad that you have problems not having the third suite occupied at the moment. I don't know if that's been resolved or not on the campus, but it's a wonderful facility. I've been there many times. This will all only enhance the Laguna Honda property. I know that the community has fought to have this done, to have the hospital rebuilt, to keep its accreditation and to move forward. And this, we believe, is the best possible use of this site, given the constraints that were put on it. So we wholeheartedly support this, as do the other neighbors from Midtown Terrace, who I believe I can speak on behalf of. We've been to many meetings with Mercy Housing as this project has been developed. I think we're just trying to birth a child, and maybe we're in the third trimester and we're going to get there. So I think that they're well on their way. We've had stops and starts. COVID was one of them, but Mercy's Housing has been there all along. They've moved forward. They've worked with the staff. They've worked the commission, and I'm certain that in the end, we'll all be there for the ribbon cutting. Thank you.
Thank you.
My name is John Tan. For me, I'm already the approachment to retire, and I can not afford the rental expensive, and I just want to find the one that could afford the housing. Thank you very much.
Thank you.
Hi, good evening, Commissioner. My name is Manson Leung. I'm with Self-Help for the Elderly. I brought that senior over here in support of the project. First of all, I want to remind everyone this project started at 2019. Right now it's 2026. Three more years is the decade gone. And we're not sure even by then will that project gonna offer the housing. So I just want to make sure everybody understand in San Francisco, the senior who is looking for affordable housing or low-income housing have exist 20,000. So this particular unit only, even though it's only over 150, it will relieve some of the tension for some of our elderly. I have run into the elderly. They have been telling me they have tried to get on the lottery system for 20 years, and she have cancer right now. She said, Mr. Leung, am I going to get housing before I die? That's a very sad thing for me to hear from a senior, which is a true personal experience. So I'm here to urge everybody. I understand there's a lot of process need to iron out the childcare space, how many square footage, but I think time is the essence. We start this process at 2019. Right now it's 2026, and I don't think we are even able to build it yet. I think we still have to have a few more hope to jump through. But at the end of the day, just remember this number. Just our agency alone, we have 20,000 senior is looking for a place called home, a roof over their head, and I cannot help them. So please help me to help them. Thank you.
Thank you.
Any additional public comment? Oh, yes. Jessica?
Yes, Jessica Pesico. Okay. So in regards to opening up a childcare facility,
Could you speak in the mic? Yes.
yes, in regards to opening up a childcare facility at Laguna Honda, I would like to say I do support that. Here are the concerns. Concern number one, paying a teacher $28 an hour in this area is pretty, I don't know where they would live. My apartment, for example, costs $2,318.52. So the wages for the teachers would need to go up. That's number one. Number two is the quality of care at Laguna Honda needs to go up first. I don't know if you can see my laptop, but Laguna Honda has a health inspection rating that is a 2-star. It's below average, according to Medicare.gov, the CMS website. And, we've had issues in the past with Laguna Honda. And we all remember there was a time where Laguna Honda was shut down or was not doing a great job. And I'm very thankful that it is here again. But, there is item number 7 that ties in with how we could fix Laguna Honda. Right now, I don't know if you can see my computer, but we have a director of nursing position.
Excuse me,
that has
are
been
you going to
open.
speak on item number 7 as well?
Yeah,
Then
it ties in with what he was saying
What,
about not having a childcare center because we can't even get our quality of care under control at the hospital. We have to take on one thing at a time. I support us, helping out children, of course, but we've got positions that are full that need to be filled. We don't even have a DON there. That position's been open for 186 days. We know based on here, there's,
again, if you're going to speak on the hiring and vacancy report, why don't we wait until that time?
I'm just saying that we may want to reconsider or maybe not reconsider how to do this, but we might want to re-strategize how we're going to open up a childcare center at Laguna Honda if we can't take one project on and make it successful. I mean, because a 2-star rating could be better. We could do it.
Thank you. And thank you. You
Are
stepped
there
in
any-
and did my job. I apologize. Yes, give me one second. There is a hand raised from the public. Yeah. Mr. Minette Shaw, are you there?
Have you got my slide up,
Mr. Minette Shaw?
Mark? Yeah, I'm here. Can you hear me?
Mr. Minette Shaw, I've unmuted you. I just want to make sure you're there before I pull up your slide.
Yeah, can you hear me?
Okay. So the public is hearing that I've tried 3 times, and you can submit your public comment in writing to me at a different time. Thanks. So public comment is over. For this
Okay.
item.
All right, thank you. And before we invite comments from members of the committee, I just want to thank those of you who have come and answered the questions that we've had that we posted, particularly over the last couple of meetings around the co-location of the child care center and the housing. As you know, the committee here, the scope of our jurisdiction is the oversight of Laguna Honda, and as such, not a lot of expertise around housing development nor childcare, early childcare in particular. And so the questions that we had really did need to get filled in by some of the detail that was provided over these past presentations and the report that we have. So I appreciate that, and that's been very helpful and very informative. We do have a deadline to provide a recommendation to the full commission at the next meeting.
I'm sorry, in May. It'll be
in May.
because it's been moved because of the budget.
Okay. So there is still a little bit of time, I think, for us to digest what we've heard today and see if there are any additional questions around just in sort of filling in some of the gaps and the blanks that have been raised over the last, particularly the last few meetings. So I want to appreciate the effort that's been put forward to answer those questions. So now I'll see if there's any other questions or comments from members of the committee.
We should have
Yes.
Suzanne Gerardo speak.
Okay. Yes, I see Commissioner Gerardo raising her hand, so please.
Thank you. I have, I am all for the child care
Commissioner,
center.
I can't hear you.
Okay, you can't hear me? Okay, I'm off mute.
You're unmuted, but maybe there's an issue with your microphone. Is there another way to switch sound?
Let me see.
Or could you log in with your maybe we could have
Okay, how
couple of
about
commissioners in the
now?
room speak and then come back to you. If can
Yeah.
you log in using your tablet?
Yes.
Excuse me? Oh, and is your volume possibly off?
No.
I don't, I'm sorry, I'm not hearing what you're saying. Thank you. All right, Suzanne, Commissioner, can you try again? It might have been my error.
Okay, can you hear me now?
Thank you, everybody. Yes,
Ed-
and it was my fault. I apologize.
Then we'll
Okay.
probably need to take,
Mr.
yeah,
Manette
that's
Shaw.
it.
Mr. Manette Shaw, we will get back to you, please. I know you're probably very angry. Just take some breath and we'll come back to you. Okay, Commissioner.
Yes, thank you very much. I would like to ask a few questions. I'm quite relieved that the age range will go to age 4 because that was one of my major concerns. But in companion to that, and I understand that, yes, TK is available. I'm not sure how many TKs, since we're not able to really increase the number of TKs with the budget for the school district. But the cutoff for TK is September 1st of that year. If in fact, as was mentioned at the very beginning, the child kind of ages out, is not ready for TK age-wise, then the family needs to find a preschool. This is the area where I'm quite concerned. Number one, for the child, and number two, for the family. As mentioned, there are no subsidized preschools in the surrounding area at all. So my ask or consideration is to really see if there can be put into the contract an exception for those that do not meet the TK cutoff to 4 years, 10 months, or whatever might work. Because I think without a cushion in there for families, could be extremely costly. And it, on a developmental basis, for a child, I am a child psychologist, it's tough then to go from, let's say, 4 years at the center at Laguna, have to go to another preschool for a year, and then transition again to a TK. So I'm just asking if there could be a consideration then to maybe whatever before 4 years, 8 months, 4 years, 10 months for those kids that do not qualify. I also, my other question is for the intergenerational, which I think there is excellent research on this for the Child Care Center as well. Is there in the intergenerational research, and I have not closely looked at it, is it a span? If I'm just concerned if we have health compromised seniors with this wonderful age group, if there can be put in place some guidelines for the interaction for the for the seniors that live within the complex. That's my second question, because as we well know, this is a germy age group, so to speak. So those were my two questions. The third is, will as you graciously said, LHH employees will get priority. Will, if they may not get the subsidy, if you can please correct me, if in fact their income level is above the subsidized level. Those are my three questions that I have concerns about.
get the answers to those questions, then we'll go to Mr. Manette Shaw.
Oh, sure.
Yeah,
Sure.
okay.
Thank you.
Yes, from the DEC.
I'll try to answer them in order. The preschool, the age range, there are preschool programs within the 94127 zip code that serve that age group, and family childcare homes that also do. But like I said, we'd have to look into what the TK capacity is within that neighborhood, and work with that provider to have, the operator, to have them really work with the families in order for a transition into what comes next, and do it in a mindful way and a timely way. If there was a license, they'd either get an infant license or a preschool license. And so, I think this is something that we can talk about down the line, but right now DEC is really prioritizing infant toddler. I think we'd have to do a little bit more data research as to what the availability is for preschool age children within a certain, like a 3-minute drive, a 5-minute drive, a 7-minute drive within walking distance, and really do a bit more of a deep dive into the data to get more information about what the provision is for preschool age children in the neighborhood and the options when they turn 4. And including SFUSD. And SFUSD, I know that they're having their own budget issues. My understanding, and I may have to confirm this, my understanding is if they have an obligation to provide TK for families that request it. And so where that happens or in what location, that's something to look into, whether they have anything nearby that might work for this location.
Yes, I can answer that. There are TKs at Rooftop, at Clarendon, and at West Portal School. But I would appreciate looking into the preschool options. I happen to be a resident of 94127, and I know it's limited and they're expensive. This is my concern for the families. So that's where, and I understand the licensing, but I don't know what could possibly be helpful, but not only financially, but developmentally for kids that don't fit the September 1st cutoff for the TKs.
Sure. And I did reach out to our data and evaluation team at DEC to get a bit more information, but I didn't give them very much notice to get more information. But I think we can do a deeper dive and get more information that might help the commissioners.
And if we could get that information prior to our next meeting so that we can consider it.
Yep.
Thank you.
And I think I remember the other question. One was about the income level. That is a cutoff point for our local subsidies. The 200% of the area median income is a recent expansion up to that amount, and that is $312,000 a year for a family of 4. So that amount changes. It's the AMI, and you look at what the AMI is for a family size, and that can go up depending on the number of people that are in the family. But that is the kind of the cutoff for tuition credit, 50% tuition credit within our network, within our local subsidies. If families are below that level, there's a certain cutoff point where they're eligible for totally free childcare or services. So it's tiered depending on income level.
But
there was
you will accept the let's say the employees that may need to pay full tuition.
Yeah,
yes?
I mean,
or no.
They would be whoever would be there. If it's a mixed income model, there'll be an option for families that pay full market rate to have some market rate spaces that can be arranged. It's like if there's priority for families and there's an option for them to serve some full fee families. I think the idea is an operator that has experience serving both subsidized families and fee paying families would be optimal because they've had experience of doing both. And then there was, I can't remember what your middle question was.
Guidelines for seniors.
Yeah, absolutely. I mean, I think, there's really intensive health screenings and early assessments done on children as soon as on a regular basis within programs. Any kind of health concern, I think you'd have to have very clear guidelines and operational expectations around what happens if a child is sick and if there's an illness in the center, and if there was any risk for the seniors there. I think as a prior director, I think in the interviews that we have with the RFP respondents, I think that would be something that we would absolutely want to highlight and talk about what would they do in that kind of situation.
Okay, and also on the other side, though, with the seniors, let's say those that are living in their apartments, et cetera, who may have a immunocompromised condition, et cetera, that whoever that there are guidelines for the seniors as well. Not just for the kids that you screen, but there would be
Or the seniors that help out in the center, or just the seniors who live there?
no, that would help in the center.
Oh, yeah, absolutely. Yeah.
That's,
But
yes.
I think there'd have to be really strict guidelines for whoever's going to be in there as part of the programming. So yeah, there would be I think that would have to be part of the operational expectations.
Okay, and would then ECE that would be part of your guidelines for whomever is running?
We don't have guidelines ourselves. It would be up to the operator to deliver that as part of the requirements.
Oh, that's what I'm asking. It would be a requirement then.
Yeah. Yep.
Okay, thank you.
All right. Thank you.
So just to be clear, then the guidelines that you were just speaking of will be part of the review of the RFPs.
I think would be an expectation that any operator, and I speak to Mercy and MOHCD around this, that they would have to have strict guidelines in place for both the children in the center and the seniors who are helping out and working in the center with them.
So this is where the representative from DPH would be particularly helpful in terms of reviewing those guidelines.
Absolutely. Yeah. I don't have, I don't have the, I think we'd need some support in determining what those would look like. Yeah.
Okay. Yes.
Oh, yes.
Yeah.
Can we go to Mr. Manette Shaw?
Yeah.
All right.
Thank you.
Mr. Manette Shaw, are you there?
I am. Thanks for coming back to me. Did you get it fixed?
Yeah, it was simply yes, it's fixed. Anyway, let me go in. Thank you for your patience.
And have you got my slide up, Mr. Morwitz?
I just pulled it up, Mr. Manette Shaw. I'm starting the timer now, so please begin.
All right. Thank you.
As you can see from my overhead chart, several changes have been made to the LHH Senior Housing Project since your February 9th meeting. The main courtyard area for the housing project's residents has increased by 875 square feet to 7,275 square feet at the expense of reducing the usable service offerings in the north building by 900 square feet. In addition, 2 restrooms in the main residential lobby appear to have been eliminated from the floor plans for when residents and their visitors reach the main entrance to the housing project. There has also been an increase of 461 square feet to the child care program space in the south building by eliminating programming for home health services for the senior housing residents. According to the January 26th, 2026 meeting notes and other recent notes of the LHH Mercy Housing MOHCD Planning Group, LHH staff appear to be more fixated on the color of the exterior buildings than they are with securing adequate transportation or shuttle bus services from the Forest Hill Muni Station to the housing project site up the steep hills. Other notes from other biweekly group meetings indicate LHH staff have concerns about sharing the shuttle bus services for patients at Laguna Honda Hospital with the residents of the housing project. A public records request to the County Transportation Agency revealed that the LHH gondola feasibility study, authorized and funded in October 2024, that was due by December 2025, has not been completed yet and may not be completed for several more months. This LHH JCC must be presented with the gondola feasibility analysis before approving the LHH housing project, so you know where on the campus the gondola will disembark its passengers. This LHH should not enter into any MOU until such time as a formal transportation study has been completed and presented to this LHH JCC. In fact, the transportation analysis should be made a formal part of any MOU. Again, this LHH JCC is wasting time. You should just abandon this housing project now and instruct MOHCD to reallocate the funds reserved for the LHH project to another more feasible housing project elsewhere in our city.
As well, Ms. Romero just indicated that the child care center may have increased to 6,600 square feet that I did not know about before I prepared my chart. That suggests that it may now have reached an increase of close to 700 square feet of space inside in the South Building.
Thank you,
could
Mr.
really-
Mitchell. Your time is up. Thank you, though. We appreciate your comments.
All right, thank you for coming.
All right, that ends public comment again. Thank you so much.
President Green.
Yes, well, thank you all for the information and the presentation. I did have some questions about the process now that proposals have been received. So I saw in the presentation that there are a series of really competent people that will be involved in evaluating the proposals, but several people in comment have brought up concerns that perhaps I didn't see necessarily directly addressed in the RFP. So I'm wondering whether it would be possible for even perhaps, Dr. Gerardo is soft-spoken, but she runs the Child Development Center at CPMC. She's about to be honored by about 1,000 people in about 2 weeks. And of all the people I know who's an expert in this area, she really stands above all. And so I'm just wondering whether it would be possible to take some of the concerns she has and perhaps better understand that, the interview process will obviously be critical. And we brought up a lot of different things, whether in fact you'll be able to adequately staff it, especially with the 0 to 3, the 0, 1, and 2-year-olds who absolutely require significant amounts of attention. It's interesting what you say about guidelines for infectious diseases, but we all know that the way COVID spread was that people spread it asymptomatically. So I think you can have guidelines, but fact is there are viral illnesses that kids shed that compromised seniors can contract no matter what guidelines you have. So that's another consideration. But I think, there are questions as to whether, if you have 100 square feet per child instead of 35, can you expand it to 70? In other words, what is the thinking, and can we get both, the experts from the DEC as well as perhaps someone like Dr. Gerardo to kind of come together and really develop a series of questions so we all can have comfort that the individuals you select will be, the best and be able to really fulfill the mission of having an excellent child care center on the Laguna campus. As Vice President Guillermo said, we really have oversight over Laguna, but not this component, but there are certainly some overlying issues where the success of the child care center and the success of Laguna, including having a place for our employees to have childcare, they overlap and they enhance or defeat one another. So I'm just wondering if you could elaborate a little bit more on the process, on what questions you might ask based on what's been said here beyond what was in the RFP itself. And then I had a few other questions, but I'm very curious to know where you go from here.
Good afternoon. My name is Liz Winograd. I'm with the Low Income Investment Fund. And
I'm sorry,
we
could you
Talk
speak?
a little
Am I
louder.
not
The
in?
sound
Oh.
isn't great on our side. Thank
Sorry. Good morning. My name is Liz Winograd. I'm with the Low Income Investment Fund. We collaborate and work with the Department of Early Childhood, provide the grants for the facility as well as technical assistance and other support. So yes, the RFP has gone out. We've received proposals. I don't have all the questions that we asked in the proposal or in the interviews yet, but we're being very mindful about that. We had 6 proposals, and we're being very mindful about sort of more so about the provider who has the experience with intergenerational programs. Of course, there are providers that we can also, if, who have a plan in place, but, obviously right now that is our priority in looking into that. But when you talk about the salaries or supporting because, the 0 to 3 children have lower ratios, there's, as Graham from Department of Early Childhood said, the Department of Early Childhood is really supporting our workforce within this system, the Early Learning for All system. And so, honestly, I've been doing this now with LIF for 10 years, and the support is there. And I don't necessarily see, from my professional experience, don't see there being any issues with hiring. Many of these programs are also programs that have multiple sites, and so they're receiving the city subsidy, the state subsidy, and the federal subsidy. So it balances out. Yes, I will say that probably in the first couple of months, there'll be a shortfall, but it's with starting up any business. I will also say that, part of the program that we provide, LIF will provide up to 3 months of startup funds, which will help with salaries, utilities, et cetera. Did that answer?
Yeah, I
your
mean,
question?
I'm just curious again, to ensure just that whatever, that you look at the choices with a critical eye and taken, it is a little different being at Laguna. And it would be really helpful to know that all the input, and again, Dr. Gerado's input would be really helpful, I think.
So we take many looks. So not only at sort of the program itself, the overall mission, philosophy, how it meets with, the cities as well as Mercy, who will be overseeing the overall, as landlords, so to speak. But we also look at their budgets, and we also, we're looking at their current operational budget as an organization and looking at their projected operational budget, as well as, them understanding even during the course of building the facility and understanding, and it can that organization, support this very large project. So we're looking at all aspects when we are making that decision.
Thank you.
Just just to clarify, the question that President Green was asking was around being able to receive input from someone like Dr. Gerardo around the kinds of questions that we have with regard to the review of the proposal. So if
Yeah,
you could
I mean,
just-
we probably wouldn't even mind if she would like to come and sit in on these interviews as well. I mean, so we will review the proposals, or she's more than welcome. I mean, there's multiple options that we're definitely open to. She's more than welcome to look at the proposals and ask the questions. She's also welcome to sit in the interviews if
Okay,
she'd
and
like.
We have volunteered Dr. Gerardo's expertise,
her
but we
hand.
should probably hear whether she's willing to somehow get involved, and then.
I think we can make
Director
something
Song
work. I mean, 6
yeah.
interviews, they run about an hour or so, we debrief. I'm sure we can make something work.
I'm more than happy to initially look at the proposals. I was also on the Children and Families Commission for 12 years. So I'm really quite familiar with early childhood ed, to say the least.
Wonderful.
But, and so I probably wouldn't have time to sit in on interviews, but be more than happy to look at the RFPs and, have a meeting with any of the concerns. Again, I want to just kind of drill down to see where the outcomes are. And that's what we're looking for, as, in just some of the more minute details, or what do we do with these, 4-year-olds where do they go, et cetera. So I think I'd be more than happy, depending on the time needed, to at least with some of the RFPs that, as you score them, are high in your consideration, to be contacted and do what I can to contribute as well, because I really want this to be successful. for both the kids and the seniors as well as the neighborhood. But, you know, like I said, I've been a resident of this area and the childcare has been very scarce and the preschool's very expensive. So this is where I'm really excited about this possibility with the parameters that I spoke to earlier.
Yeah, and we all, I mean, I think I can talk for my partners as well, Mercy and the Department of Early Childhood and MOHCD, is that we really want this to be a success. And I think that's the piece also where LIFT comes in, and DEC is really making sure that the provider that we choose is really, you know, a good fit for Laguna Honda, for intergenerational programs, as well as the community. And as we know, D7 really needs more childcare, and especially to be part of the city system.
Thank you. Director Tsai.
Thank you. I just want to add a few things. I think this is a very good discussion with very salient points that are good to hash out with a bunch of subject matter experts. I think overall, and I spent some time, I know our teams have been working together between DPH, MOCD, and others. I'm very grateful that DEC and the colleagues with their expertise are involved. I do feel confident in connecting directly with Dan Adams, who leads MOCD, that these are all topics we have a commitment to figure out with the right Health Commission DPH input. As you can tell, there are quite a number of nuances here. I think what I've heard very clearly from the commission, the Health Commission here, is a desire as we work up towards a vote of actually a jurisdictional transfer in support of this project, given what I believe is a clear need both for senior affordable housing, an integrated set of services, and the need for additional, especially subsidized early childhood support. There's a great case for change here. A ton of work that's been done. Nothing's perfect, but with all the constraints. And I think the commission has some good, important input and thoughts, especially with the expertise of Commissioner Gerardo. I understand MOCD to be committed to making sure there's a way to get that input, to document the right pieces, including on selection of the right vendor, or at least the criteria evaluated. Commissioner Gerardo, some of the things that you mentioned, and I believe MOCD is committed that we will find a way for that to happen with the right subject matter experts around that, and that DPH and DEC has already, and colleagues has already evidence will be involved in that selection process. The other thing I think we have strong commitment on to just reaffirm is we believe this project makes sense. The jurisdictional transfer that will be coming up for the commission is required to make the subsidies and the financing work through. And we will be very clear in writing in the agreement that should for some reason something fall apart, the jurisdictional transfer comes back to DPH. It's not that we're signing off collectively on a jurisdictional transfer. And if this project doesn't go through, who knows what else could happen. We're all very excited for this project to go through, but there will be safeguards in place around that. And that was important to a range of commissioners. So with those pieces, I think we can together in partnership with MOCD and colleagues, DEC, manage the different pieces here, tap on the time and expertise of Commissioner Gerardo. Probably, Suzanne, you may not have time for every single interview, but we should figure out the right way to get that input in place. I believe this will come back to the JCC and then to the full commission. And what Dan and I discussed is that would be a good place to read out to the JCC some of the nuance on these pieces leading up to a vote, and then a recommendation to the full commission. So with that, I feel like a lot of wheels are in motion. I am not by any means an early childhood education center expert, but I see and understand the need for, based on what I'm hearing from the community as well, alongside senior affordable housing, which we all believe we need, and that will help us in the overall healthcare delivery system as well.
Okay, thank you all for your comments and your presentations. I think that the last word at this point is you can see that over the now almost 2 years that we've been contemplating this housing project, the clear needs of senior housing, senior community and health needs outside of Laguna Honda, childcare needs, both infant, toddlers, and pre-K, as well as just the models of an intergenerational interaction for the purposes of health and well-being are things that we're all very interested and want to see successfully implemented. Thus, the questions and all of the detail that are coming forward and some of the data that we're still looking for in this, I think, a very collaborative, participatory process. More to come. Questions about or I don't know about questions, but information about the jurisdictional transfer, questions about transportation, and then about the process of reviewing the proposals or things that we are anticipating coming up at the between now and the next meeting. So we look forward to that and being able to be very confident about whatever recommendation we make to the full commission in May.
And I misspoke. I misunderstood what you said. I want to make sure we're clear for the record. You were correct. The next JCC meeting in April is where the committee will consider recommending the MOU and jurisdictional transfer to the full commission. Full commission will hear it in May.
Right.
So,
Okay.
thank you. Sorry for that. Anything else on this, or are we moving on?
We can move on.
Okay, thank you. We can move on to item 4, the executive team report. And give me a second to pull it up. Thank you, presenters. By the way, have a good day. All right.
Can go to slide 1. Good evening, commissioners. Name is Deltar Sidhu, CEO for Laguna Honda Hospital, presenting our monthly exec report. First, I wanted to kind of start by highlighting some of the events that happened last month. On February 25th, as part of our culture change initiative, we hosted a first coffee and chat with CEO, that would be me, providing an opportunity for the staff to be able to connect with me, share their experiences, and ask questions to really build a community feeling. So that was actually a success. Quite a bit of staff showed up. There's some pictures, as you could see, and we will continue to build on the success and have more such events and provide opportunity for the staff to be able to engage. Next slide. As you know, February was a Black History Month. Laguna Honda celebrated both Black History Month and Lunar New Year. I want to thank our Black History Month Planning Committee, who curated a dynamic calendar of educational and inspiring events that brought staff and residents together in celebrating our culture, history, and unity. In the month, we began with the Unity March and a powerful rendition of the Black National Anthem along the main corridor of Laguna Honda. Then festivities continued with a lively Black History trivia challenge and inspiring poetry slam, which our residents participated in. Residents also and our staff enjoyed the performances by Georgia Blues Band and a spirited karaoke session, adding music and joy to the month-long celebration. I want to thank to the staff who also participated in the event by wearing gold, red, and green or black for the theme days that we had, representing the colors of the African diaspora. Appreciation also goes to the food and nutrition services, who also provided a lot of the food and other horticulturally inspired meals in the cafe for our month of Black History Month. Our Lunar New Year, we also celebrated with various activities, making paper lanterns, line dances, and Dream Flying Music and dance performances. These are the events that are really designed to bring the community together and celebrate the diversity in our staff and both residents to really lift the spirits up. Now moving on to the admissions, next slide. As you know, we've been providing continuous updates on the admissions, and we've been moving towards our goal. Currently, our census actually as of today is 606, so we've been inched above the 600 mark. Our full census goal is 636. And in February, we added, as you could see, about 27 new admissions, which was very similar to the previous month. Next slide. And as far as admissions planning, we have continued to make sure that we follow our strategy. We have continued to expand South 5. We're actually almost full. I think today's census was about 46 or 47 residents in South 5 with a capacity of 49. Our staff did an amazing job making sure that we support these residents. And also we continue to make sure that we support the staff as we grow the census as well. Some of the things also we're looking at making sure that we are maximizing the use of our dementia beds, which currently we have about 16 vacant beds in that area. And also making sure that we are going through our list that we had with residents who are waiting for beds at Laguna Honda. We continue to explore ways to make sure that we can bring them in as soon as we can. And lastly, we've been continuing to engage with our community partners to ensure that we can have that engagement on an ongoing basis to have a strong referral source. And next slide. Here just kind of shows how we are progressing towards the goal, and we are at the end of the month, we're around 600, and as I shared, we currently are over 600. Next slide. And this kind of shows the breakout of the beds in a different areas. You could see a chunk of the beds are really in the secure dementia unit. And as I have shared, we're currently looking at exploring and how do we continue to best use that capacity as the census growth in North Mezzanine, our dementia unit has been slow. So we're looking at other alternatives to how we can utilize that space so we could maximize the capacity in Laguna Honda. And as far as this is our long-standing slide that we continue to show the improvement in our decisions for the referrals coming from ZSFG. They are currently for a weekly little less than 2 days. I just want to share that some of this data, we are engaging with our residents from Z that's transferring at a very early stage, even though when they're not ready. So some of this data may have some artificial inflation in the decision making as we're waiting for these patients to be ready prior to transfer. Next slide. And this slide kind of covers all 5 priorities and showing that we are approximately around 3 days to decision for all referral sources. Next slide. So this slide was a request where we continue to show that on a month-to-month basis, we are very similar on the kinds of referrals being accepted and denied. As you could see from historical data, they're mostly about residents either being too complex or not meeting the SNF criteria to be in Laguna Honda because they're appropriate for lower level of care. And it's been very stable from month to month, as shown with this slide. Next slide. Okay. On this slide, it really shows, as you could see, our denial rate has also pretty consistent between 20 to 30%. And been pretty stable from month to month as well. Next slide, Mark. And these are the major referral sources as shared. And as you could see, we had a strong referrals coming from our priority 5, which are community hospitals. And we continue to see a strong referrals from Z, which is the blue bar as well. So those 3 are the main sources of the referrals for us currently. Next slide. Next one. Okay. On this one, just wanted to share a brief update on some of the stuff that you have requested in the past, really sharing update on staffing, especially on our key vacancies. We have 0942, 2 vacancies for Manager 7, which are our Director of Nurses, and we're making progress there to be able to fill that. We have an 0941, which was Manager 6 for Assistant Nursing Home Administrator. We are currently we were in the selection phase, but we're holding off that vacancy, not planning to fill at this time. And then 0933, which is Manager 5. This is for Emergency Management and Disaster Preparedness role. We actually have, this role has been filled with a TEX position. A staff member is currently in that role, and we are working on making filling that vacancy permanently, but we do have a staff member in that role. And then 0923 is a materials management position, which we also have a staff member in an interim role. So most of the vacancies have functional roles already in place outside of the DONs. Next slide. So as you know, we have done amazing work. Our team has done amazing work in improving the census at Laguna Honda in just last few months. We wanted to make sure we do that in a way that we continue to support our staff. So staffing was very crucial to us and making sure that we support staff. So as part of that, the initiative was to making sure that we continue to improve our staffing, as that was the biggest concern, not just on our staff, but also even some of the residents as well. So as part of that initiative, I just wanted to share some high-level information that we've been working on to making sure that we make improvements. Part of that was really looking at coaches. Initially, just going back about 2 to 3 years when I started at Laguna Honda, we have approximately 40 plus residents with 90 shifts per day of one-on-one supervision, which we call coaches at Laguna Honda. Currently, right now, we're down to 9 residents. Even in the last few months, we have reduced that number from 25 down to 9, which translates to roughly about less than 20 shifts per day. So that's been huge amount of work on teams that have taken, making sure as we did that reduction that we keep our patients safe as well. So that's additional staff that's available to work on the floor instead of really doing one-on-one supervision. In addition to that, we also have a large number of escorts where we have staff members going out to appointments with residents. And although in some cases it's necessary, we wanted to make sure that we are absolutely using in an appropriate way. We really started to look at the process and making it more robust. For example, for dialysis patients, they're going out 3 times a week, 4 to 5 hours per session. And we have staff members going out with the residents where we really didn't need them to. We have a door-to-door drop-off with transportation. And we were able to work and make sure that we can reduce those escorts. And now we have only 1 patient on dialysis who's going out with escort. We're looking at residents who have capacity going out and pass on their own, but they were going out to appointments with escorts. So really looking at and putting some strong processes in place. We've been able to make some reductions there. The work is just started in the last couple of months. So there will be much more improvements there, but we have been able to make some reductions to make sure that those PCAs, that's actually was going out with the residents, is now available to work on the floor. Another thing we were looking at is really, as I shared, we have about 700 direct care staff in Laguna Honda, but we realized there's a large number of that staff is on leave and modified duty, and that was also hurting us. So as part of this process, we really wanted to make sure that we have a robust process in place, that we're really managing the staff appropriately and accounting to make sure that we have folks with approved leaves. As we started this project, we were able to make some strong gains. We have a list of about approximately 50 staff members as we were doing this work. 10 of them actually recovered and came back on full duty. as we learned that some of those were not approved. And then we currently have about 31 staff that's on actively modified duty. And there's 4 that we have referred to our reasonable accommodation department. So there were some gains there. And we are continuing to look at our processes to ensure that we really manage this group tightly. So folks are either being accommodated appropriately or have appropriate leave in place, or we're making sure that they are working with HR to have approved leave, or coming back to work if they have no approved leaves. Also part of this initiative, we were looking at any staff member who may have had no work activity. But we realized there was a large number of staff that had no work activity in the last 6 months. So HR really started looking at that, working with us. And as part of that work, there was a list of about approximately 50 staff members. We were able to separate 18 of them, where now we can open up those recs to really hire into those. So we can increase our staffing. And then about 27, I believe, has been referred to reasonable accommodation, and they're going through the interactive process, whether we can approve their leaves and working with those folks. So there was a lot of work happening, and part of this is also hiring. As we are opening up these requisitions, we're making sure that we continue to make some progress on hiring as well. So we have done a lot of work over the last several months to improve staffing and be able to, as I said, open up South 5, and now South 5 is almost at full capacity. So all of that work was happening simultaneously. So I want to thank especially Maria, our interim DON, who was leading a lot of this work along with her staff, and they did a tremendous work. And this work is an ongoing thing. It's not one and done. We will continue to make sure that we have good processes in place so we never fall back, and we can continue to keep these gains as we're making them. I think that's all I have on this. I'm happy to answer if you have any questions. Thank you.
Thank you. Is there public comment on the executive team report? No? Oh, okay.
So sorry, could you, remember, please speak in the microphone.
Yes, sorry about that. So when I look at the report and the other pieces of information, there is conflicting pieces of information about the number of vacancies for RNs. So, I didn't want to say this earlier.
I'm sorry. Again, are you
This is
speaking?
the
We're talking about his executive team membership thing. He's talking about in his slides, he mentioned how he has a page on vacancies, correct? I'm saying this because I have to go to another meeting at 5:30 to help for the unhoused at 25 Van Ness. So I have to make sure I can get there on time, okay? I don't know if I have enough time to go to 7. But the information that was talked about during his presentation is conflicting. Let's break this down for a second. So he's got a slide here about the vacancies. And on this, you can see that there's no RN positions. You can also see right here, he talks about coaches. But when you look at his FTE slide, or I don't know if it's his, but it says 0%. But when you turn to this other page, it says that if you go to page 2, there's a 5% vacancy rate for RNs. So there's 9.0 vacant FTEs. But we know from the budget meeting that there is no new FTEs. So what is it? Are there really no FTEs that are nurses? Because we know that according to the lawsuit settlement, where Laguna Honda had to pay $5.8 million, And there was a number of sexual assault cases, right, with the nude pictures, with, residents who were drugged and abused by others. We know that one of the doctors who
Right, but so.
did this
Remember,
stressed the importance of staffing. So I just want to make sure that, if he's on the executive team, he understands that one of these slides right here should reflect the need for more experienced nurses on there. Okay.
All right, thank you.
Given the fact that there's on here on page 2, there is vacant 9.0, 5% vacancy rate for RNs.
All right, thank you very much. Anyone else in the room on this item? Okay, there's a hand. Mr. Minetshaw? Mr. Minetshaw, can you hear me?
Yes, can you hear me?
Yes, please begin.
All right, thank you, Mr. Morwitz.
The state of the hospital slide on page 5 of the executive team report is a long overdue, but welcome change to the data presented on this report by including data on bed holds. It's disturbing seeing that there has been a net flow gain of just 9 additional residents to LHH between the end of January and the end of January, given that the report asserts there were 27 admissions in January. Thank you.
I meant between January and February. My typo, my bad. Thanks, everyone.
Thank you.
Okay.
Item number
Okay.
6.
Any comments or questions? Yes, President Green.
Well, first of all, thank you for the report. It would be, I think, very helpful for us to get some follow-up on what you're finding with staff, because it is a little confusing. And in particular, when you speak about, staff that either on leave and wasn't realized or need accommodations, you have several rubrics there. And if you could give us some data about that, and in particular, how many of them are actually involved in direct patient care versus other aspects of staffing, like, EOC and the other divisions you have. I think it would be really helpful for us to understand that, and also have some sense for how long you think it might take to kind of get everything squared away. How long do you think it will take to really make sure that everyone who needs accommodations is properly accommodated, that people who aren't working are, as you said, the positions are now open and so forth, because it's so critical to have adequate support. So it would be wonderful to know that. The other question I had is, as you cut back, certainly it's understandable, the escort component of this, but when it comes to the coaches, what metrics are you following to ensure that you've right-sized the coaching? In other words, there are always going to be falls. We hear about them. Some of them, one of the ones we heard was unavoidable, even though a coach was involved. But I'm curious to know what parameters you're choosing to make sure you're really right-sizing your assignments of coach and the necessity of coaches.
Thank you for your question, Commissioner. So one, I just want to start by saying coaches or one-on-one supervision is really not an industry standard. You will have, and I speak to my counterparts across the Bay in Alameda Health System and many other in the private industry as well. One-on-one coaching is used in very, very limited scenarios and for short period of time. However, at Laguna Honda, it was a widespread practice. As you could see from the numbers, we had almost 90 shifts per day, which adds up to millions of dollars per year in one-on-one direct care, where we are taking that staff away from being able to provide and meet needs of all the residents. So it's not an industry standard. However, in some cases, it's absolutely necessary. We have complex residents at Laguna Honda. Some residents have behavioral issues, and we want to make sure we keep other residents safe and the resident themselves. So we have some residents who are behaviorally complex that may need one-on-one supervision. Some residents could have sexual behaviors that's not appropriate, that may require one-on-one supervision. So there are some cases, absolutely. In some cases, if somebody is having an SI and they're deemed high risk, we will absolutely want to make sure we protect them and have one-on-one supervision. But outside of that, especially with falls, we have a lot of residents on coaches for fall precaution, where instead of really exploring ways to how do we keep these residents safe with alternative interventions, the first reaction was always, let's put a coach on them. Yes, absolutely, coaches can prevent, but that's not the best way to utilize and be able to meet the needs of all the residents with a resource that's a finite resource. We don't have an unlimited number of staff, obviously, given the budget challenges, right? So we wanted to make sure we look at all the residents with fall precaution that had coaches, and how do we keep those residents safe in alternative ways. So we have been trying different things. Obviously, in some cases, looking at the data to whether this resident is actually collecting the data, whether they're actually what their normal behavior is during the time they're under supervision, to see if they actually need supervision. In some cases, we have been trying silent bed alarm, which is not really a restrictive method because residents doesn't see any alarm. Unlike traditional alarms, they only ring at the nursing station if the resident is getting out of bed. Although it's not a fail-proof because the resident could still fall, but we have a lot of residents who do still, when we're looking at the data, we have residents who are falling when they're going to the bathroom themselves. We're able to intervene much quicker when these alarms are going off. So we have some of those interventions in place. So we're really looking at a wide variety of interventions to keep the residents safe as we were reducing these coaches. And our falls have actually fairly stabilized if we look at the data outside of even when we were reducing coaches. So that's the work that we've been really doing to make sure that we reduce the coaches and absolutely use them when they're necessary, not as a practice, but as an exception.
So it's mainly falls and then individuals who might need coaches based on behavioral or impulsive behavior. Are those the two large groups that require?
Those are the two groups that really had coaches, but right now, most of the residents who have coaches are the ones that have behaviors.
Yeah.
Most of the residents on fall, I would say 99% of those we have weaned off the coaches from them.
I see.
Yes. Definitely.
Thank you. Commissioner Green. So I just wanted to share that the Falls Committee and the Coach Committee have been working closely now. I know in the past, we have these committees we're working in silos, but I think it's important for us to sort of collaborate to, review all of our residents as coaches for Falls to see if, we have interventions in place and, how do we support the staff in ensuring that we have interventions as opposed to just, assigning a coach. And several of the coaches have been with the residents for years. And I think now it's more tightly monitored with that, like every week we, reassess and meet with the nurse managers to make sure that the coaches are absolutely necessary. And if not, we have interventions in place.
Thank you.
Thank you.
And just to add, a lot of this work is actually being driven by the teams who are involved in resident care, right? We're just providing direction, but the work is led by the teams. As Maria has mentioned, the Falls Committee, we have a coach committee that really drives this work forward. Thank you.
And your other question? Okay. Okay, I guess we can move on then.
All right, thank you.
Thank you.
We can move on to item 5, cultural change and change management. And give me a moment to pull up the presentation. Okie doke.
All right.
Please just let me know when to go to the next slide.
Okay, will do. Good evening. My name's Ami Fishman. I am the Interim Chief Experience Officer for Laguna Honda. I want to thank the commissioners for the opportunity to present on our work on culture change and organizational transformation. I can go to the next slide. So as you know, this work, because I spoke to you years ago about some of this work, has been going on for many, many years, but really started to come into focus during our recertification journey. And I think what we realized was that in order to be successful in our recertification and to stay successful, we needed to not only address the systems change, the policy changes, our practices, but also really look at the culture of Laguna Honda and how we work together as an organization. So I want to first just start by saying we have come a long way, such a long way, I think, in this journey. And there's so many successes to celebrate. You heard about a lot of them tonight, and just to say them again, we successfully recertified, which was amazing. We've increased our census to over 600. We've had successful surveys, many successful surveys after not having them, and we really made a lot of leaps and bounds in improving our practices and just kind of the overall functioning of the organization. And that is really due to the people who continue to show up and do the work, who stayed through and really weathered all of these storms. So it's been pretty remarkable as I was preparing this presentation to think about, like, even from the time that we started talking about this work as culture change work, how much has changed. Go ahead on to the next slide. So holding that truth, I also want to acknowledge that those years of crisis took a major toll on all of us and impacted how we function and how we work together, and that we're still finding our way out of that. We continue to operate in some ways in a kind of a culture of crisis and a reactive culture, and that's been difficult to shift out of that. So what does that look like on the ground, and how does it show up? We see it both in our resident and family experience and also in our staff experience, and we know how interconnected those two are. So when our staff are feeling happy, when they feel supported, respected, treated fairly, we see that in the experiences of our residents and family members and in the care that they receive. So they really notice. So on the left side, I'm sharing just a little bit of the data that we have with you. In our last family survey from September, only 54% of the family member respondents felt that the care teams were working well together. That's a number we definitely want to improve. Also, we see a high number of grievances related to courtesy, attitude, communication, those types of things that are often indicators of high stress, frustration, or burnout from the staff. And then on the staff experience side, this is data from our employee engagement survey results, which are almost a year old now, but show, that staffing was a major factor in why staff are feeling disengaged at work. Another factor was not feeling like they were included in decisions that affect their safety. And respect is a really interesting one. So overall, Laguna Honda last year scored very high on this metric. 85% of our staff who responded said that DPH expects people to treat each other with respect. But when we drill down, which I'll do in the next couple slides, you see a slightly different picture. Next slide, please. So this is just going a little bit deeper into the grievance data. This is week by week. You see kind of these top three themes that just continue to be our top three themes. So attitude, courtesy, communication, and care treatment. And so this is a place that we're really tracking, how people are doing and how do we improve the experience for everyone. Next slide. And then, as I mentioned, this racial equity question about people treating each other with respect. When we look at the data across all respondents, is that purple line, we see 85%, which is quite high. But if you look at a comparison, you see that our staff of different racial groups have a really, really different experience of respect in the organization. So Filipino staff, 90% of the survey respondents said that they answered favorably to this question, versus only 54% of our Black staff. So this is something that is really a big indicator for us, that we want to ensure that people are having a consistently positive experience of respect, that everyone who walks through that door feels respected, feels that they're treated with dignity. Next slide, please. So this is kind of our future state, our aspirational state of where we're aiming to be a functional, stable organization in which staff, all staff really feel empowered and trusting to raise and address concerns, where there's healthy teamwork, where there's excellent care, where we have accountability, we have consistent communication. And these are kind of 4 key strategies that we're employing to support this change. So engagement at all levels, continuous improvement, system integration, and cultural alignment. These all interconnect. And a lot of them connect with the other work that you heard about in the previous presentation. But I'm going to focus in today on the engagement at all levels framework and really give you a sense of hopefully most of the many things that we're doing to address these challenges and support change. Go ahead to the next slide. So this is our engagement at all levels framework. Culture change is not easy. It's not one thing. It's many things all at once and over time. that requires, a consistent experience that helps build trust and helps changes be sustained. So we're really trying to move at a lot of different levels at the same time. So this kind of shows what those levels are. So at the system level, we've been working to shift engagement in our labor monitoring committees. These are our monthly meetings that happen with all of the unions to just improve the communication, collaboration, and trust. I'll talk about each of these a little bit more in a moment. The model neighborhood we'll hear more about in a moment as well. This is at the operational level. How are we functioning as a smaller unit, right? How are the neighborhoods functioning together? Advisory groups and councils. This is a place where we're, again, seeking to have more conversation, more engagement, more co-design, people who maybe aren't involved with the unions per se, but have information that they want to share, have ideas, and need to have a place where they can be heard. And then the staff events and offerings, you heard about some of them already, but this is about building morale, building psychological safety, building community. There's a lot of data that indicates that when people have an experience at work that brings them together with other people, it really changes how they feel about being there. It changes what's possible for folks, and it just kind of humanizes us to each other, which sometimes we forget to do in the midst of all of our work. So go ahead and go to the next slide, please. So for the Labor Management Committee, this is really in collaboration with our union partners, with our HR partners. We have worked systematically to improve and restructure the monthly meetings for the UAPD, which is our physicians, the RNs, the pharmacy, and our citywide LMC. So we're making sure that those agendas are developed and shared in advance, that there's prep meetings so that data is available. I think there was some sort of trust broken or frustration about the meetings not being as productive as they should be because the information wasn't ready and wasn't being shared timely. So making sure those are ready, improving our follow-up. And then Diltar and myself participate in those meetings, and we're there really to support improved communication, to try to help shift in moments where things get maybe a little adversarial, to try to help us kind of shift and align back to what is our goal here and how can we really be in partnership together. Next slide. So for the model neighborhood, I spoke about this a bit before, but again, wanted to kind of share with you more of a concrete timeline. So the model neighborhood, that is an idea that was brought to leadership both by our labor partners and by our internal KPO partners, our Kaizen Promotion Office partners. And it was something that I think the unions, in particular SEIU 1021, was really offering as like, this could be a place where we could try to do something different. We could work our way out of some of these kind of entrenched issues we've been having, and is an example of the kind of partnership that we're trying to build. So labor's been very involved in every step of this process. Our advisory group includes union members and leaders who've committed a lot of time to meetings and providing feedback to help ensure that it's successful. So I just want to really recognize them and recognize that partnership in practice that's happening right now. So I think last time we spoke to you about this, we were convening the advisory group. We were just choosing our neighborhood. February was really dedicated to doing assessment with that team. And then in March, we're starting to really jump into our PDSA and training components of the model neighborhood. So I know there was a question about what exactly are we doing? What exactly are we measuring? And there are a number of ideas that the team has identified as priorities. We haven't settled exactly on which one or ones we'll start with yet, but some of the ideas they're considering is revamping the unit-based QAPI to be more relevant, more meaningful, and impactful for the team. I think more what a QAPI is really intended to be. And then there's other ideas such as improving the process for taking weights. So right now, the way that weights are taken is create some inconsistency across the hospital, across the neighborhood. So the team's going to be deciding, I think, in the next week or so, what those priority places to start are, and then we'll really jump in from there. Next slide, please. So excited to announce North 3 is the neighborhood that was chosen. Chosen again in partnership with the advisory group who really did an assessment to determine what neighborhood was ready. And we chose this neighborhood for a number of factors, including relatively stable staffing, strong leadership on the neighborhood, and a willingness and desire for change. The team is really excited to be part of this pilot. I think they have a lot of ideas of things that they want to work on. So the KPO team, as I mentioned, has been working on the assessment related to the different domains. And the idea of this is just to really understand kind of what parts of these processes are in place, what parts have maybe started but are not quite where we want them to be. How is the team doing in implementing a lot of the things that we say we do as a hospital? So the goal is to get to where they are at a level 3, where these areas around engaging staff with daily management system, strategic alignment and problem solving, principle-based leadership, and achieving results are all at a 3, where they're sustained, integrated, and refined with reliable results. So we've got a kickoff neighborhood meeting. The goal is to identify a couple of strong leaders on that team who are going to help make this, sort of socialize this and keep folks on the unit level engaged. The KPO is going to be supporting team building workshops and trainings. And then we're going to be looking at some unit-specific data around resident experience, staff experience, KPIs, integrate their ideas and PDSA, and do some redesign of the tools to really make sure that they work for people. I think we've seen, as you all have seen, there's a ton of data. Sometimes a board full of data doesn't translate to like, okay, what do we actually do with this, right? How does this relate to what we're doing on a day-to-day basis? So lots of exciting opportunities there. Next slide, please. A little bit about the advisory groups and councils. Very excited that nursing got their PCA and charge nurse councils in place. Those are monthly meetings, 10 to 20 attendees for each shifts. Leadership often attends, or often different leaders are asked to attend and participate, and then issues are shared back with the nursing leadership. So that's a place where we're seeing increased engagement, just increased like communication and conversation and more dialogue between people. EVS is really excited. Our EVS leadership is excited to also have an EVS council. So they are getting guidance from the nursing team to figure out how to start that and develop the charter. They've already implemented some things like a suggestion box just to increase opportunities for more staff to share feedback and ideas. And then the leadership share out those suggestions at their huddles and talk about what they're doing to address them. There's a workplace safety committee that's in development. This is also part of the broader DPH improvements around safety. And then I realized I neglected to mention we also have a staff retention and staffing improvement work group that's run by nursing and is a multidisciplinary group. So that's a place where we're really looking at nursing retention specifically. It is, as you all know, very challenging to get people in the door, get them through orientation, all the hiring processes, and we really want those amazing folks that we hire to stay. So we're looking at surveys to understand how people are doing in 30, 60, 90 days. And then we're also looking at what are some targeted interventions we can do, in particular with managers, to support the experience of the new staff in feeling more welcomed and more supported as they're coming in. Next slide, please. And then staff events and offerings is the last part of that four-tier grid that I shared with you. So this is all the different ways that we're trying to just promote more communication and dialogue. Some of these things we had before COVID, and they petered out during COVID, and then with all of the recertification got lost in the shuffle. So some of these are things I think we're just kind of bringing back. Schwartz rounds is one of those examples. So we have quarterly Schwartz rounds now. Our next session is actually Wednesday, and it's working with residents who are suffering and how we cope. We're very excited to offer this space for our resident-facing staff to really share with each other, communicate, and build trust and empathy. We have now scheduled out our town halls for the year. So we have regular town halls for nursing as well as all staff town halls. Our first all staff town hall scheduled for the 18th. You heard about the coffee and chat. It was great. I was there. It was really interesting to see, people don't necessarily know. It's a big campus and not everybody knows, who the CEO is or feels that they can have a conversation with him. So really opened up a lot of space and we'll continue to do those things. Departmental meetings on culture of safety and engagement. This is where we're taking our employee engagement and our culture of safety data and we're taking it on a kind of a roadshow to the neighborhoods and to the department. So this has never happened before. This is really about engaging each team in a conversation to look at that data, think about how it relates to their work, and help kind of come up with ideas about how we can improve. And finally, departmental technical assistance and support. So our team does a lot of team-specific trainings, kind of targeted technical assistance and skill building with teams on respect, on conflict communication. We've worked since last January with 12 departments and led 28 sessions on these topics and seen really great results. And then the next slide, please. Just to give a little bit of data about some of the things that we're doing to promote wellness and community. Again, since January of 2025, we've had 44 staff engagements. These are events, resource fairs, pop-ups, ways of just kind of letting staff know, hey, we're here, we're supporting you, come and do this thing. Last week we had a jump rope for joy event with snacks and jump ropes, and we've engaged over 1,800 of our staff. As of February 27th, the Staff Wellness Hub is now open 24/7 with badge access. So we were able to increase access to this really important space for staff, especially on the weekends and evenings, who can come and either relax in the space or exercise. And then our on-site wellness offerings, we've increased by 300% because we started with 1 day, now we got 4 days worth of activities. Yoga, Zumba, meditation. 2 of the 3 of these are staff-led, which is really exciting. And we're asking participants to respond in a survey about the experience. And they're sharing that it's making their day better and it is working to relieve stress. So again, these are all little things that we can be doing that help demonstrate through our actions, through what we prioritize, that we care about our people. And next slide, please. So this is the last slide. What's next? We're going to continue to sustain and refine these improvements. We're going to work on our model neighborhood. We really want to keep scaling what's working. I think looking for those bright spots and seeing how we can scale them out. We'll be doing pulse surveys and ongoing data collection. We have more surveys coming up. The resident and family surveys happening again this month. Staff culture of safety survey in the summer. And of course, we know, these are challenging financial times. There's a lot happening that's going to obviously impact how staff are feeling. But my hope is that we're improving how we work together and how we navigate those challenges so we'll be able to come through them strong. So welcome any questions or comments. Thank you.
Thank you, Omi. That was a full and detailed overview, a lot to digest. Is there any public comment?
Any in the room? No hands, and there's no remote hand.
Okay. Comments from the committee? Yes, Dr. Green.
Well, thank you first for all the work and all the thinking that's gone into this and all the enthusiasm. It's really wonderful. The question I have is, all of these goals are obviously laudable and staff retention is critical. But I'm wondering, once you are completing your surveys, the resident and family and the staff and the safety of culture, what other outcomes are you thinking about? How do you plan to, as you've said, scale? When will you know it's working? How and when will you scale it? And then how are you using the baseline recommendations from HSAG just as a jumping off point for some of these things? Because I obviously don't understand much of this, but when you do a PDSA or you're looking at QAPI, it seems like there's so much that we've gleaned. I mean, our decertification was truly a teaching moment for us. And so where you springboard off of all of that to move forward, where do you balance what you've already learned versus reinventing the wheel? In other words, where are you pitching that balance between input and engagement equals execution? Because if things are just, handed to people without any explanation or just say, do this, you're clearly not going to have uptake. But how are you thinking about those things, and what metrics are you really looking at beyond the obvious surveys?
Yeah, that's a big question. I will do my best to answer, and if others want to jump in, feel free. I mean, I think culture change is work that is over many years. It does take time, and I think there are indicators along the way if we're trending in the right direction. So things that we expect to see are improvement in experience of our residents and their family members. They notice when staff are stressed out, they notice when things aren't going well, and they tell us. So I think those indicators are very powerful for kind of real time. Are things getting better? Are we working together better? I think also the retention data is going to be an indicator. I think there's other factors, obviously, just the economic situation and the job market as a whole. But these indicators from new staff, the surveys that we're doing with the new staff, 30, 60, 90, to see, there's sort of, and I think we're really working in partnership with a lot of the other initiatives around Everybody Works, around they're all very interconnected. But I do think that it will be helpful for this initiative to look more closely at some of the HR data to really understand, anecdotally, I think there's an idea that people are, not sticking around or don't want to be here, but are we seeing that play out in the data? And if not, what are those other kind of indicators of like, what is the health of the organization, right? So things like call outs, things like people on leave, things like attrition, those are all some of the kind of nuts and bolts data that I think we see when we have a place that people want to work, they want to stay there, right? Obviously, some folks are going to leave for all kinds of reasons, but are we trending in that direction? And then I think one of the challenges is to be very, transparent, is like, there's a ton of data. There's a ton of information that I think all speaks to this. So how do we kind of pick a couple of meaningful things and look at them over time? So the two things that staff identified were the staffing issues and the safety, right? And so those are really priority areas that we're very much focused on. And I think we will see that information. Are we making moves in that direction based on the culture of safety survey, based on our employee engagement survey, but also based on people's participation in these various forums? There's a lot of information around, how do we improve the safety of the organization as a whole? How do we ensure that people have more opportunity to communicate about what their concerns are and feel heard? So I know that's maybe still a little bit not as concrete, but I think that those participation in those advisory groups, participation in surveys, right? If people don't feel like it's worth it to share their thoughts, they're not going to bother to do it. So our culture of safety survey had quite a low participation rate last time. I think seeing that really boost up is going to be a big indicator for us. Do people feel that this is being taken and used and seriously considered? So those are some, but I definitely welcome if there's specific things you want to see. I know you mentioned the years of service. I think you mentioned that, Commissioner Guillermo, like how do we see changes in engagement over people's, tenure? And we do see in the employee engagement survey, we do see when people first join, they're excited and enthusiastic, right? There's kind of like a high, and then there's a bit of a dip. And then there's sort of like we come to accept certain things. So I think we want to see, it may always come down a little bit from, you know, what you imagined it was going to be, the perfect job, but hopefully we can have, again, a more consistent experience across race, across age, across years of service. I think that would show us a lot about how we're doing as an organization.
And then with the model neighborhood, how long do you think it sounds like you've got all the elements in place to be incredibly successful. So when do you think you will kind of be able to showcase that for other neighborhoods and try to get buy-in? And do you think that you mentioned how stable the staff is on that neighborhood. And of course, you know, there are issues as you've articulated already about, you know, being able to keep stable staff on units, which is so important, especially for your nuanced patients, where if you know the patient, you can really give better care. When do you think you will have that kind of staff stability that may already be present on N3 so that you can really scale this to other neighborhoods? Do you have a timeline? Do you expect any new shocking learnings? And then what do you think you can accomplish pending kind of this staff stabilization you're talking about?
Yeah, that's a great question. I don't know if anyone wants to take it. I mean, I can just say for the, you know, the idea of the model neighborhood is, as the KPO team likes to say, it's very difficult to boil the ocean, right? Like we can't make all the change in all the places at once. So it gives us a chance to really go in one small place and try things out, and then create some norms and some standard practices that we can promote across the whole hospital. So I don't think that will take very long before we start to see that. I mean, I think the unit-based QAPI is a great, you know, example of how, or even just like kind of improving the huddle board. You know, a lot of the neighborhoods, not just North 3, have been, I think, ready for some changes. I can't speak to the timing around the stabilization of the staffing. Yeah, you want to speak to that?
So I just wanted to share. So we are still in discussion with the union regarding our upcoming bid. So we actually have a meeting this Wednesday. So hopefully once they approve the staffing model that we shared with them, then you were planning to bid sometime in the maybe last week of March, if not sooner. So I think, you know, with that, we'll be able to sort of stabilize the units, and we'll see consistent assignments throughout the, you know, the hospital. Currently right now, we have around 70-80% of staff who bidded last year. But of course, we have newer staff and, you know, like temporarily assigned staff that also needs, you know, like their own assigned units. So we're hoping to see that happen around end of March. And we'll give you an update by April.
Thank you.
And all of the, you know, all of the work that Diltar shared about looking at the leaves, you know, looking at the escorts, and all of that really connects to, right? Because I think for some of those neighborhoods, and this has been a big issue on paper, it looked like they were fully staffed, but the experience that staff was having was not that was not their experience. So yeah, so hopefully we'll really see through all of these interventions, see some change and some stabilizing across the board.
Thank you.
Thank you again for the presentation and for all the work that is being implemented. One of the questions I have is around the scaling of things when the time is ripe for that. Just in terms of being able to scale things, anything beyond sort of the initial pilot, the readiness of the rest of the units or the folks or the whatever is something that also needs to be assessed. You know, there's always a ramp up, testing, you know, assessing and then going back and retesting and so on. And for folks that aren't in that process, what happens sometimes is, you know, just different sets of expectations or changes in the citizenry around those that are going to be affected by the scaling process. And so I'm just curious at how are you going to ready the rest of the folks, given that at this point you don't even know what that scaling what the elements of that scaling is going to be. And folks already know there's a model neighborhood. It's just something you don't have to answer now, but it's just something that I'd like to hear more about in terms of a successful scale model and the readiness of other elements of Laguna Honda with regard to that scaling.
Yeah, absolutely. Yeah, I will think on it more. I will just say, I think, we had a lot of experience through our recertification of scaling very quickly.
It's different kind of scaling.
And
though.
not in
Not-
the, yeah, but that's what that was what I was gonna say, not in this way, right? In a way sometimes where, and I think it contributed to some of the challenges that we experience in terms of employee engagement and of our overall kind of culture. So I think we're really trying to be mindful of that, right? And learning some of those lessons, like how do we do this in a way that isn't reactive, that brings people along, that identifies what people need in order to be successful, and kind of goes back to, and this goes to your earlier question around the HSAG recommendations, right? The spirit of those recommendations, we want to really fulfill that spirit. I think sometimes they were implemented with haste, right? Because we needed to get them done, and there's opportunity there where we can look at, like the huddle boards, for example, there's improvement that we can make that maybe we missed the steps of like really making these something that we're going to be really accessible and connected for the staff on the unit. So it's going to include, I think we're looking to our KPO partners for their leadership and guidance because they've done this, like at General, they've done this. But it will include education, it will include conversation and communication, opportunities for people to identify those issues that are most impactful to them. And then testing things out, right? Really, really having that experiential learning of, because that's part of it too. People have, we've heard a lot about all the things that we weren't doing right that we needed to fix. And this is an opportunity for people to get to really experience doing something right and getting to celebrate that. So yeah, more to come on that question for sure.
Great. Looking forward to hearing more about how all of the levels of culture change are happening from system to the individual levels and all the readiness for being able to participate and I think execute around any of the findings and issues that are being raised. But really glad to hear that this is sort of a whole enterprise effort.
That's well said. And it's a very much a team effort too. Absolutely. Thank you so much.
Thank you. We can move on to item 7, the hiring vacancy report.
Hi, good evening. My name's Jennifer Magnuson. I'm a manager in hiring and selection. So the February Laguna Honda hospital vacancy rate stands at 9.1%. It's 0.32% with attrition savings. In February, we had a total of 11 hires with 2 separations. The 2320 RN vacancy rate is 4.54%, but it's negative 0.22% with attrition savings. And any questions you have, I'm making it brief.
Okay, great. Thank you. Any public comment?
Is there any public comment in the room? No, there's only staff. Let's just see. No, there's no public comment remotely.
Any comments from the committee? No? Okay, thank you.
Yep, thank you.
For being brief.
Yep, thanks.
Move on to item 8, the regulatory affairs report.
Good evening, Commissioners. Nazanin Zahir, Chief Quality Officer for Laguna Honda, presenting the Regulatory Affairs Report on behalf of Geraldine Mariano, Co-Director of Regulatory Affairs. For the month of February, Laguna Honda submitted a total of 7 facility-reported incidences to CDPH, and 6 anonymous complaints were shared with us by CDPH for the month of February. CDPH has not started their investigation for the facility-reported incidences in February. 2 site visits did occur in February. CDPH investigated a total of 27 FRIs that spanned from July 2025 or pardon me, so they didn't investigate 6 facility report incidences. They did investigate just 1 from February. So when they came in February, they investigated from July 2025 up to February 2026. During that time, they also shared 6 anonymous complaints with us that covered staffing, nursing services, and quality of care. The preliminary outcome for 26 FRIs and 6 anonymous complaints was no deficiency. And then at the time of this report, we still had 74 cases pending investigation by CDPH. Any questions on this report?
No public comment.
Okay, thank you, Naz. Any questions? Okay, we can continue.
Okay.
Thank you. We can move on to the policies, item 9.
Thank you very much. On behalf of Carmen Trin, Director of Performance Improvement, the facility is presenting 3 policies for review and consideration for approval, 1 facility policy recommended for revision, and 2 departmental policies recommended for revision. Hope for your recommendation to move to the Health Commission.
There's no public comment.
Okay.
So I would move to present these policies and procedures to the full commission.
Okay,
for
I'll
approval.
second. I'll second.
Favor?
Aye.
All right, thank you.
Thank you.
We can move on to item 10, a consideration for a closed session.
Okay, is there a motion?
Move to go into closed session.
Second?
All those in favor?
Aye.
Okay. Could someone, actually, I'll close the doors in a second. Give me 1 second. Folks who are watching, you will not see or hear us while we're in closed session, but we will be back. Thanks for watching or participating in the meeting. Just 1 second. You're back in open session. Commissioners, in closed session, you approve the credentials report and the participants report. Please consider a motion to just disclose or not disclose discussions held in closed session.
Move not to disclose.
Second.
All those in favor?
Aye.
And consideration for adjournment, please.
Move to adjourn.
Second.
All those in favor?
Aye.
Aye.
Give me 1 minute to shut us down, but thank you all.
This does not reflect how important we think you all are.